Welcome to the Virginia Hospital and Healthcare Association's Patients Come First podcast series. Podcast episodes are available on VHHA.com and on popular podcast hosting apps, including Apple Podcasts, Amazon, Spotify, and many others. We're a member of the Virginia Audio Collective and the World Podcast Network. Podcast episodes also air Sundays at 9 a.m. on 100.5 FM, 92.7 FM, and 8:20 a.m. across Central Virginia, and 1650 a.m. in Hampton Roads. Please send questions, comments, feedback, or guest suggestions to bcfpodcast@vhha.com. Again, that's bcfpodcast@vhha.com. And today we're pleased to be joined by Amanda Feaster, a nurse with Valley Health's Shenandoah Memorial Hospital, who is a former paramedic with Valley Medical Transport. She joins us for a conversation about her work, her career journey from EMS to bedside care, and more. So with that, welcome to the show, Amanda. Thanks for being here.
Thank you for the opportunity, Julian.
Well, we appreciate you taking the time. Our return listeners know that we like to start these conversations by getting to know our guest a bit better. What we know, Amanda, is that you are a new nurse at Shenandoah Memorial Hospital after recently earning your registered nurse license, and before that, you spent 12 years as a paramedic with Valley Medical Transport. We also know that you're a wife, mother, grandmother, and friend. Beyond those few details, Amanda, what should people know about you and your unique personal story?
Well, thank you for the opportunity to tell my story. I am a 54-year-old who is blooming in the fall of my life, but fall flowers are pretty too. My life began, I didn't have an easy childhood. I had parents who were there for me continually, but due to a medical diagnosis, I no longer had eyelashes in grade school. And it might seem like a minor thing, but back then I was continually made fun of because of my appearance. I hated to go in public. My parents prayed for me and reminded me daily that I was loved and that I was created on purpose for a purpose. I got myself into an unhealthy marriage at a very young age, looking for acceptance. I went on to achieve my associate's in social work degree. With an elective, I took the EMT course. I fell in love with that. I became a volunteer for the local ambulance service in Petersburg, West Virginia. I went on to have 2 children who are awesome. When my children entered school, I became a certified special education aide so that I could be home with them when they were home and work when they were in school. When my children became middle-aged, I became a patient advocate at Winchester Medical Center Emergency Department. I loved that position. I comforted grieving patients. I gave directions to people who needed to go on to a different facility. I was with patients who were dying that had no loved ones near them. That's when I knew my call. No one in my family had been in the healthcare prior to this, so it was a whole new experience, but I knew that I was born for that. I was with 3 out of my 4 grandparents when they passed away, and as sad as it was also an honor. In 2009, I left my position as a patient advocate so that I could do my paramedic clinicals at Winchester Medical Center where I was comfortable. I did that the week after I finished paramedic school. My dad went with me and my children on vacation to the beach, at which time my 63-year-old dad died of a heart attack on the beach with me. That was the hardest thing I have ever had to endure in my life. I performed CPR on him, went to the hospital. They were great with me. They didn't push me out of the ER. They let me stay there while they continued to work him. They allowed me to call my mom and let my mom speak to him before they ceased efforts. But they did. They ceased efforts, and my dad died. It took me 6 weeks before the deadline to take my paramedic exam to take it. I passed on the first time, which I know was through the grace of God to have been able to do that. So then I served as a paramedic, 911, and transport. The transport company that I first worked for went out of business in 2013, and I was able to obtain a position with Valley Medical. When I went there, the very first test that they gave me was a 63-year-old person having a heart attack and all that, and I just burst into tears. I thought, I can't do this. They let me go to the bathroom. The boss came and said, Amanda, you have a wonderful personality from the 2 weeks that you've been here. We want to help you get your confidence back, and we're going to train you and put you through some remediation where cardiac issues are concerned because of the pain and the things that I had been through. So they did not need to keep me in 2013. They could have said, you have enough issues and we're not going to do that. They kept me. I appreciate that. I've had several of my bosses move on to other positions and move out, and I've had other ones come in. I've had a wonderful support group. After 30 plus years, my unhealthy marriage dissolved, and my coworkers and my bosses were there to say, it's okay, Amanda, you got this. And then a year or so later, I remarried, and I had this opportunity to go to nursing school. They supported me in that.
Well, Amanda, that is a fascinating story and a unique and complex journey, and I appreciate you sharing so much of your life and your background and how you got to this point with us. We mentioned at the top that you spent 12 years as a paramedic with Valley Medical Transport, building connections with patients and colleagues before pursuing your RN degree and licensure. I imagine completing that education and training was a bit of a balancing act. So if you would, tell me about what inspired you to make this mid-career transition and the process of juggling paramedic work, family life, and nurse education.
What inspired me most was the opportunity to go to college, and the fact that at 54, I don't know that I'm going to be able to move bariatric patients in and out of houses at the age of 65. However, I love taking care of people, and I wanted to continue that process. So I did that. The support of my family to do this, it was very hard. I would be lying to say that there weren't times that I cried myself to sleep, that I thought, I am not going to be able to meet this deadline for school and do my work. But every time I thought that, somewhere out of the blue, a supervisor, a coworker, a family member, or even sometimes a stranger on Facebook would say, hey, I see what you're doing. You've got this. We support you. At my lowest point, God always sent somebody to pick me up and say, you can do this. And that's how I got through.
Amanda, in your experience so far, what are some of the differences between the role of paramedic, which can involve responding to emergency calls in the community and then transporting patients to the hospital, and hospital-based nursing care for patients at the bedside?
Well, that's an interesting question. When I was in nursing school, I would keep wanting to give answers of what I would do on the 911 side, and my instructors continually said, Amanda, you're not on that side now. On the 911 side, and even in transport, we have protocols that say you can give this medicine or you can perform this intervention without getting permission. On the nursing side, everything you do is with permission. However, there are a lot more things that you do. On the paramedic side, we intubate patients. On the nursing side, you are not allowed to intubate patients. But on the nursing side, you get to see the process of the continuity of care. Someone comes in and they're in congestive heart failure and they can't breathe and they're on tons of oxygen. And through the interventions that you perform and through encouraging them to make healthy choices while they're in the hospital and further when they get out, you see them overcome that and get better. And that is so rewarding. A lot of times on the emergency side, we never know what happens to our patients. That is something that is changing in the healthcare, that now we are able to go back and check on patients that we transported to see how they work through the system. But that's the main difference, sir.
Okay, well, I appreciate you sharing that explanation with us. Valley Health's Shenandoah Memorial Hospital is a 25-bed acute care hospital in Woodstock, Virginia that offers a broad range of services, including 24/7 emergency care, inpatient and outpatient surgery, cardiopulmonary services, women's care, diabetes management, behavioral health, a sleep lab, health and wellness programs, and more. It has also been recognized as one of the top critical access hospitals in the nation. People listening to this may not be aware that rural hospitals serve a key role as healthcare providers in the community they serve, despite often facing broader environmental and structural challenges. Amanda, as someone who's worked in rural care for a number of years, how would you describe the importance of Shenandoah Memorial to the people it serves?
Oh, my goodness. In the 12 years that I've already worked for Valley Health, my ambulance is stationed in Woodstock, where Shenandoah Memorial is. So I've been there countless times. If you're having an emergency, be it cardiac arrest or anything else, even someone in a diabetic emergency, they are top of the line for entry care. And if they can't provide the care you need, then someone like myself would come get you and transport you to a place that can. Or, air service would provide those services. The doctors there are among the best that I've seen anywhere. And in my learning process, if they weren't too busy, I could ask them, explain to me why this medicine does this, or why you want me to do X, Y, Z with this patient. And they would explain things to me that would help me further my knowledge and be able to help other people down the road. I have met the most caring clinicians in the world at Shenandoah.
And Amanda, from what I gather, Valley Health supported your career transition from paramedic to nurse with a tuition reimbursement program that's open to employees, some schedule flexibility, and other incentives. That, along with your personal drive, helped you achieve your goal, as you said, even when things sometimes looked bleak or daunting or challenging. As someone who successfully navigated a career transition, what advice might you give to others who might also be considering a similar path or career transition?
Valley Health definitely supported me and made going to school possible. I live in West Virginia and attended a Virginia school, so I did have to pay for my education. But they were, at least half of my tuition, they were able to help me with in exchange for me working for them for a year after I graduated. I am so very grateful. And the people that worked with my schedules, like I said earlier, I hated to miss work or have to change my schedule, but they never made me feel guilty about that. They're like, we're here. You're going to help patients down the road. You're going to help Valley Health provide better care for our community. I truly could not have asked for better people to work with and superiors.
Well, it's great to hear that you had that experience and that you've been able to pursue your dream in such a supportive environment. And really glad to have someone like you who so clearly cares about patients in the communities you serve being part of the care team to folks in the Shenandoah Valley. Amanda, you've been great to talk to. I've really enjoyed learning more about your story. We are just about done with our time together, but before we conclude, we do have a tradition on this podcast to close out by asking our guests a pair of surprise questions. To keep things interesting, we have a list of 10 mystery questions, so if you would, please choose two numbers between 1 and 10, and I will ask you the corresponding questions.
3 and 7.
Okay. 3. What is the most adventurous thing you've ever done?
I went to Ethiopia and did medical missions, helped take care of 10,600 patients in 12 days.
Wow, when did you do that?
2017.
Oh my, and how did that come about?
I had been to Russia with my dad. My dad was a pastor and a carpenter. He would go all over the world and help fix orphanages and things like that. And that's how it began. We were actually going to go to Ethiopia together. That he pushed me to get my paramedic, and then, he passed before we could go. But a few years later, I was able to complete our dream.
That's fantastic. I appreciate you sharing that. And then you also selected number 7, and that question is, what is one quality in others that you admire and try to embody in your own life?
Compassion. Compassion for the journey. We never know what others are going through. And just show kindness and compassion.
That's great advice and something I'm sure we all could try to incorporate more in our lives. Well, Amanda, again, I've enjoyed our time together and the opportunity to speak with you and to learn a little bit more about you. And with that, that's going to bring us to the close of another episode of the Virginia Hospital and Healthcare Association's Patients Come First podcast. If you like what you heard, please make sure to leave us a 5-star review on Apple Podcasts and subscribe so that you know when new episodes are available. We also want to once again thank our guest, Amanda Feaster, a nurse with Shenandoah Memorial Hospital, the Valley Health System, for joining us today. So thank you.
Thank you.